Again, good afternoon, everyone. Welcome. Thank you so much for joining us today for this very important topic. Again, for those just coming in, I invite you to share your name, where you're joining us from, and maybe what you hope to get out of today's webinar with us in the chat. But my name is Leslie Giglio with the Community Technical Assistance Center at NYU's McSilver Institute, and I would like to welcome you today to Understanding and Addressing Microaggressions in Children's Mental Health Services with myself and Dr. James Rodriguez. And so we have Jim, who is our Senior Research Scientist and Director of Trauma-Informed Services here at the McSilver Institute. He is a New York State licensed clinical social worker and psychologist with over 25 years of providing mental health services to children, youth, and families in a variety of service settings, including direct practice, training, and research experience in the area of trauma treatment and services. And myself, again, my name is Leslie. I'm a senior coordinator here with CTAC, and I'm a public health practitioner and racial justice advocate with nearly a decade of experience. And I'm really committed to eliminating health inequities among historically marginalized communities and have worked to address racism as a root cause of these inequities over that time. So have worked across a variety of community-based settings in the direct service space as a case manager, program manager, and policy advocate, primarily within environmental justice and immigrant justice, and really committed to advancing upstream solutions that uplift community expertise. So excited to have you all today. Great. And so just to provide a brief agenda and just get a sense of what we're going to be covering today. So we are going to be discussing microaggressions. We're going to start with a really broad overview of microaggressions, particularly the different types of microaggressions, and especially the impact that these microaggressions have, especially for our children, youth, and families. We're also going to have some chances to apply this material. So Jim will be going through a case study as well as discussing different strategies at the individual, interpersonal, and organizational levels in order to implement this work. And then we will be ending with some resources for you all to just help support you in this practice. Great. And so before we dive into microaggressions, I want to just take a moment to quickly orient folks using this lens of systemic oppression. And so systemic oppression really exists at the level of institutions. So think things like harmful practices, as well as across these different structures like the education sector, health, transportation, etc. And these systems are really interconnected and reinforcing over time. And these interlocking forms of systemic oppression ultimately influence and trickle down to our interpersonal interactions, as well as our individual interactions. So our belief systems, our values, our actions. And these negative forms of prejudice and bias, including microaggressions, are things that are learned throughout our lifetime because of these broader institutional systemic factors that come into play. And at the same time, because they're unlearned, we also do believe that they can be unlearned. And so we're going to be focusing today, again, at that individual level in the form of microaggressions. So we're going to show a quick video, if you can play that, Vanessa. And while you watch this video, just think of some main takeaways or what are some things that are coming out for folks.
I had a dream the other night that I was walking around a new reptile store, amazed by all the lizards and other reptiles, when I literally ran into someone else doing the same exact thing. We became fast friends and started talking about our love for reptiles. And they told me they always wanted Komodo dragon, and today was the day. I asked them what they wanted to name it, and they said Cami, short for camouflage, and I thought that was hilarious. Then they started telling a joke, and I woke up. Something was looming inside me, and I realized that I was worried that this joke was going to be directed to me, and perhaps commentary on my hair, or my skin color, or what country I'm from. In my dream, I felt both happy to have a new friend, and scared that they'd dislike me because they just see me as these external things. You know, the way the world does. Like, where's my family from, or am I mixed, or other comments. It's like this.
Do you really pray 5 times a day?
You don't look like you grew up poor.
Where are you really from?
You got a license for that wheelchair?
You should smile more.
Is your hair real?
Your English is so good.
This is what it's like. They were all terrible for one important reason. They diminish who we are, who I am. So I decided to tell my therapist, I want her to know what's going on in my mind. I'm trying to be more honest about my feelings. So I tell her, and she says, "How do you feel about people commenting on your race and appearance?" I felt angry, and honestly, I feel angry that you'd even asked me how I'd feel. How do you think it feels? Do you even understand any of this? She paused and said something really important. "I want you to know I'm listening. I truly believe that you are the expert of your own experience, and I trust that what you are saying is true." So I said, "Thank you." It's frustrating, infuriating actually, to constantly field questions and comments about who I am based on someone else's thoughts about me. Honestly, it's exhausting. And it's not just about my hair or my skin color, but it's also about my body and even about being a woman. Someone asked me when I was going to have a baby when I was at work the other day. Maybe I don't want to have a baby. My therapist then said, "I'm so sorry you've had those experiences. I have a friend who's talked to me about her experience, and she's told me that there is a word for these. They are called microaggressions. They're often indirect and sometimes coded, and I can absolutely see how exhausting that can be. Just anticipating what someone will say or when or what will happen after. Some people experience these many times a day, other people less frequently. This is a thing, microaggressions. Yes, I shouted. And then my therapist said, "It seems like your dream was about you working through this. What do you think?" I think she is right. I was absolutely processing microaggressions in my dream. It's from an experience I had in class where my so-called friend made a joke about mixed people, and I felt so angry and confused. I think it actually triggered a fear of not belonging or something, and honestly, I don't want to hang out with that friend anymore. I'm not sure I trust them. I think that's what is hardest. I never know who to trust. And then my therapist told me that she understood, and that it made sense, and that I can continue to process in my sessions with her. She talked to me about self-affirmations as one way to validate myself when these things happen. She said this way I could support myself when I'm experiencing these, and I can then advocate for myself. I realized I can create a protective shield when people say dumb things. My therapist also taught me about micro-interruptions. She helped me understand that I can pause and point out someone's biased behavior or language. She said I can call attention to it, address it quickly, and then move on. I guess it helps me to stand up to hurtful statements or gestures. I'm more than my hair, my body, my skin color, religion, and even my diagnosis. I'm so much more than other people's stereotypes. People may not realize what they're doing because it's so normal for them, but it's not normal for me. Not now, not ever.
Great. And I put it in the chat, but feel free to share some things that might have come up for folks, things that you picked up on, whether it's the therapist interaction or the client kind of processing those things. And yes, the slides, again, will be available 2 to 3 days after this presentation posted to our CTEC website. Okay, and while folks are putting that into the chat, Vanessa, if you can scroll to the next slide, please. Great. So while folks are putting that in, yes, micro interruptions, that might be a new term for folks. The client's anger to the therapist makes sense, and the therapist's response was very instructional. Correct. And right, the notion of the burden that the client feels coming into that space, right? Empowering the patient on behalf of the therapist. Yeah, seeing both sides of those interactions. And yes, that is a really important part we're going to be talking about today. So the therapist not assuming what the client's experience was and allowing her that space to express her own feelings. We're going to be definitely touching on that anger is valid in that same vein. Yes, and the cumulative impact of microaggressions, absolutely. It's these sort of slights that come to you over your lifetime, and it really is that cumulative power that those hold. Great. And we'll be breaking down the different types of microaggressions, so don't worry, and we can start there. And so microaggressions, again, are really those everyday verbal, nonverbal slights, snubs, or insults that can be intentional and also unintentional. And ultimately, they communicate these hostile, derogatory, or negative messages to target persons based on their marginalized group membership. And so there are 3 main different subtypes of microaggressions, the first being microassaults. And so this is sort of traditional racism, as we like to think of it, and these are often conscious, which is what differentiates them from the other two. And so microassaults are really explicitly meant to hurt the intended victim through either name calling, purposeful discriminatory actions. And so this can look like calling a person who is an immigrant in this country an alien, and just those really direct insults. And secondly, we have micro-invalidations. And so these are actually often unconscious, and they really serve to invalidate the feelings or also minimize the experiences of a person holding a historically marginalized identity. So this can look like in the video, if a client is coming to a therapist and sharing, let's say, an experience of them being followed in a store, the therapist could negate that. And so that would be an invalidating experience. And thirdly, we have micro insults, which are often also unconscious. And so these are rude and sensitive comments that subtly disrespect a person's heritage or identity. And so this can be something like, you don't really look transgender, you don't really look multiracial, and sort of negating that. And so today, again, we're really going to be focusing on microaggressions, particularly as they impact the mental health of children, youth, and families. And so some of the ways that these can show up in clinical care for microassaults, just to bring it out a little bit further in that setting. So this can look like, I can't understand you, can you speak English? Refusing to use someone's preferred pronouns or names after they've instructed you to do so, or things like kids from that neighborhood always have behavioral problems. And I'm sure as we're reading these out, people have heard some of these. Feel free to also put them in the chat of just things you've seen in your practice or experience yourself if you'd like. And for micro validations, saying, oh, kids get teased all the time, or like I mentioned before, are you really sure you were being followed in the store because you're Black or because you're so young? And lastly, micro insults. So how did you learn to speak English so well? Or maybe we can get into some activities that allow him to blow off steam, like basketball. So all of these really kind of playing into, again, these stereotypes that we have about different historically marginalized groups that are ultimately informed by these broader systems of oppression. Great. And traditionally, like we've been covering thus far, we tend to think about microaggressions as verbal slights. So the things that people say to one another in those interpersonal reactions, but they can also be communicated through nonverbal or behavioral cues. And so this can be something like educational or career tracking, going back to the comment about that kids should pursue basketball, that's how they should blow off steam. Also lower expectations for folks from historically marginalized backgrounds, not thinking of them to succeed maybe in the same way as other groups. Being followed in a department store is a really common one. Things like distancing, avoiding exclusion from groups based on identity. It can be the visuals in a workplace, in a school, of who indicating who belongs or who doesn't belong in those spaces. And obviously things like tokenism and glass ceilings. And lastly, these things can also show up in our physical environment. So the places where we live, where we work, where we play, our schools, our medical offices. For workplace settings, this can be being the only person of color in all-white offices. In a clinical setting, this might be images of only heterosexual couples in a clinic that serves LGBTQIA communities. And lastly, this can be intake forms. So the lack of intake forms with options that are inclusive of all identities. I know for one, this happens to me all the time. I identify as multiracial, and I'm always very limited in terms of having to check a singular box or not having a box to check at all for my identity. So just some of the different ways that these can come up for folks. And I'll hand it over to you, Jim.
Thank you, Leslie. And thank you, everyone, for joining us today. And so, as Leslie's been sort of laying down the groundwork for, the society and the systems of oppression that exist, where microaggressions become possible, we're reminded that although they may be unintentional, and whether they're unintentional or not, research has demonstrated that repeated and prolonged exposure to these kinds of experiences can impact mental health, health as well, and mental health services. And so When we think about the impact of microaggressions on mental health, we know that it can impact, it can create psychological distress. We know that microaggressions are strongly associated with anxiety, depression, lower self-esteem. And as we think about these daily exposures to microaggressions, whether they're assaults or insults or invalidations, that repeated exposure to microaggressions can be a form of chronic stress and lead to low-level traumatic symptoms, especially for marginalized groups, those impacted, children and people of color, members of the LGBTQIA community, women, especially all of them, can have PTSD-like symptoms, including hypervigilance and emotional dysregulation. And lastly, identity development. As we think about sort of forming a strong sense of self and identity, these repeated exposures to microaggressions can impact identity development. And we wanna share this video as we think about this idea of the impact of microaggressions on identity development. We think about sort of in a racialized society, the messages that young children can get about their color can impact and the formation of a healthy sense of self. And so we're reminded of the doll studies that occurred in the 1950s that led to desegregation of schools. But Kenneth and Mamie Clark famously did some doll studies exposing children to black and white dolls. We're going to share a little bit of a clip of a video about the doll studies, or not about the doll studies, but a replication of the doll studies that was done fairly recently. We're just going to share a minute of this or so, just to give you a sense of how this doll studies occurred, and again to remind folks that these dynamics still occur in society. Vanessa, go ahead and play.
Can you show me the doll that you like best or that you'd like to play with?
This one. I like that one.
Show me. Okay.
This one.
That one?
This one. I like to play with this.
And can you show me the doll that is the nice doll? And why is that the nice doll?
She's white.
And can you show me the doll that looks bad? Okay. And can you and why does that look bad?
Because it's black.
And why do you think that's a nice doll?
Because she's white.
And can you give me the doll that looks like you? "15 out of the 21.
Thank you, Vanessa. And so these studies have been replicated over the years, not only with Black children, but also Asian, Latino, and white children with the same results. An overwhelming bias towards whiteness. So when we think about these, as Leslie was talking about it, these are the structures and institutional racism that occurs that can create these kinds of biases that are both internalized and externalized as well. There's also good research to demonstrate or show that microaggressions have an impact on mental health services. So we can see decreased engagement. Folks who've been exposed to microaggressions are less likely to stay in care and or to seek care. They're more likely to view services as culturally insensitive or inappropriate, and they're more likely to terminate services prematurely. Oh, Vanessa, can you advance? I'm having trouble with this. Okay, thank you. And then as we think about mental health services, in particular with young children and youth, we're reminded that young people also come to services with microaggressions that might be connected to their mental health. So we know mental health stigma is a major obstacle to seeking and staying in services. And oftentimes, those messages that young people get, verbal microaggressions about their behavior, characterological responses to oftentimes difficult. So, talking about young people with depression as lazy, or those with anxiety as being not tough enough, leading to internalized messages about their own character, seeking or looking at their own faults and internalizing those negative messages about themselves. So when we think about racial, gender, ethnic microaggressions, all of the forms of microaggressions, in addition to that, young people come into services with already sort of internalized negative self messages about their behavior and who they are. So we want to turn to a bit of a case study. Just a little bit of a setup. We have this little sort of visual of Where's Waldo? And so we're going to share a little video, and we want you to sort of look for and seek microaggressions in this video. So just a little bit about this video. This video was created by the Center for Child Trauma Assessment Services and Interventions at Northwestern University to highlight the impact of adverse childhood experiences, ACEs, or chronic trauma. And in this video, however, you will see examples of microaggressions. And so a couple of things I'd like you all to sort of look for. One is microaggressions and how they kind of play themselves out in this video. And then we also want you to observe the counselor. So in the clip that we're going to show you, there's a lot more to this video, but in the clip that we're going to show you, the counselor is talking to Jade about an experience that she had. And we also want you to observe the counselor in this instance and see what she does and what you think works and what doesn't work. So with that said, Vanessa, if you can play the video.
Happened according to you.
What? So you can diagnose me with some kind of mental illness?
I'm not here to diagnose you. I'm just here to listen. If your teacher did something hurtful to you, you can tell me with as little or as much detail as you'd like.
Whatever. Doesn't even matter.
It matters to me.
Let's just get this over with then. I was in English class on Tuesday, and class had just dismissed.
Wow, your hair's so pretty.
I was heading to geometry, but Mrs. Thomas stopped me.
Jade, can I talk to you for a minute?
Yeah, what's up?
It's about your essay, the one on the bluest eye.
Yeah, it's pretty dope, huh?
Yeah, a little too dope. Who wrote it for you?
Here I am looking like a dumbass thinking she wanted to give me a gold star or something. I wrote it myself.
This is a college-level essay. You have a C- average in this class. How do you explain that?
Well, this is the first book on the syllabus I actually liked. Toni Morrison's one of my favorite authors. Maybe I'd write better essays if we didn't read boring books by white men all the time.
Now, don't pull the race card, Jade.
The race card has been pulled ever since I popped out of my mom's black-ass uterus. I'm not pulling anything.
You're just being disrespectful, as always.
So we go back and forth for a minute and things start to get heated. I'm late for class, plus I'm not trying to lose my voice over someone who don't want to hear me, so I try to bounce.
Jade, don't you dare leave until you tell me the truth.
I told you, I wrote the goddamn essay.
Fine. You just keep on lying and cheating and you'll end up in jail, just like Nikolai.
Now that set me off. I get real defensive about Nick. You keep my brother's name out your lipless ass mouth. I was mad heated. I knew it was a mistake as soon as I said it, so I try to leave before I say anything else I regret, but... Bitch, fuck you, racist bitch! I don't know what came over me. As soon as she grabbed me, it was like an out-of-body experience. I just reacted. Then she called the cops on me, and they pulled me out of math class. They said I sprained a wrist or something. And now I'm here.
Jade.
I know. I shouldn't have used that language. I should have just controlled my reactions. I shouldn't
That's
have.
not what I was going to say at all. I was going to say thank you for sharing that, and I'm sorry that happened to you.
What?
The way Mrs. Thomas accused you and spoke to you was racist. You didn't deserve that. And she definitely shouldn't have touched you.
No one's ever believed me when I said a teacher was racist before.
And I'm sorry for that, too. You deserve to have adults in your life who listen to you. Jade, have you experienced any other significant or stressful life events lately?
No, not really. No one's died or anything.
Well, it doesn't have to involve anyone dying or getting hurt. It could be a new addition to the family, the loss of a job, a recent move.
Well, my brother just got out of juvie, and ICE deported my dad back to Trinidad. Those count?
Yes, those definitely count. I totally know what you're going through.
You had a brother in juvie and a dad who got deported.
No, not exactly.
So you don't know what I'm going through. And I don't need you to sit in here and act like you do.
You're right. I don't know at all.
Why do adults always assume they know everything?
I misspoke. I shouldn't have said that. I apologize.
It's okay, I guess.
And would you like to continue with our session? It's also okay if you'd like to stop here.
We can keep
Thank you,
going.
Vanessa. So just looking at the chat, just a few comments that came up. I like that she allows Jade to steer the conversation as she feels comfortable. And I think you see that in a couple of places. I love how the therapist validates her experience and a couple of seconds to that. She's helping her to identify and acknowledge other stressors in her life that Jade was discounting. And thank you for that, Amy, because I think, again, as we think about it, one of the things that I want you all to consider is, again, at this point, we need to be looking at these kinds of microaggressions as a form of chronic stress, just as we would process any other form of traumatic or chronic stress that someone can go through. Thank you. Her whole body language changed. Yes, you could see her body language change in response to that validation, apologizes and acknowledges the hurt her statement caused for Jade. Thank you for that, Allison. Luani, I love the empathy and how she shows so much of her human side and not being just a therapist. The real relationship and the real conversation that's occurring in that interaction, right? Very real on both sides, obviously. Um, and and yes, empowering her. So not just apologizing, but giving Jade the power to end the session if she desired, giving her that autonomy, right? That ability to guide the process. Um, and a few others apologizing. I'm seeing a few of these, owning your own mistakes, very much so. Thank you for all of those comments, folks, and there may be others. And so as we think about microaggressions, as mental health practitioners, what you can do to improve your ability. So we want to look at both what you can do at an individual level to improve your ability to help navigate microaggressions among the people that you serve. But we also want to look at what can be done at the organizational level, and then what you can do as an individual practitioner to think about and deepen your self-awareness around microaggressions. So with that said, Vanessa, can you advance the slide? Thank you. So at the individual level, for you as practitioners, a few points. We want to sort of, again, underscore the importance of practicing cultural humility. I think we often use that term cultural humility very broadly, but I think in many ways you can see in both the video that we showed earlier as well as the one we just showed with regards to Jade, the importance of deepening your self-awareness and deepening your cultural awareness And so one of the things that you can do is to take an implicit attitude test. I think it's important for us to reflect on our attitudes. What drives microaggression is the implicit biases that we hold about certain groups. I always encourage folks to take implicit bias tests because they are a way of assessing and addressing those implicit biases that we all hold. And just to be clear, implicit biases are very normal. We need to understand that they are a part of how we develop cognitively and socially. And so, so implicit attitudes and biases are there. Test yourselves and look at those biases that you may hold with regards to various groups that are out there. Get curious. I think that you saw both in both of the videos today, especially the last one on Jade, getting curious, right? When those judgments come up, when those biases come up, and they do come up for us. We just have to be aware of them, converting those biases or those judgments, those thoughts that are coming to our head into curiosity, into better understanding the experience. And I think many of you kind of chatted in about the comments, right? Letting her drive, understanding and validating her experiences. And then acknowledging and preparing. And what I mean by acknowledging and preparing is all of what I've kind of talked about already, acknowledging that they exist, that they happen, and also acknowledging and believing, as you saw Jade share, right? No one ever believes me when I've said a teacher has been racist, right? That can be very common. Believing people's experiences. And then practice rupture and repair. You all kind of noticed the counselor in that instance apologizing, taking ownership, as many of you said, right? Acknowledge and apologize, correct and process, right? So correct that microaggression, that invalidation that may occur, and then process. And oftentimes that's not only a good opportunity to process the impact, but it's also an opportunity to process the relationship that you have and being able to take ownership of those blind spots that we may all have in providing services. So processing the relationship as well as processing the impact of those microaggressions. And then mindful communication, reframing questions and using open-ended questions, again, to really practice curiosity in the work. So for example, things like just being mindful of are you both her real parent, right? So sometimes we can microaggress parents as well. The questions that we ask about families. So it's more important to sort of, as you're thinking about getting information and assessing situations, broadly asking more open-ended questions. Tell me about your family. Tell me about your culture. Tell me about your neighborhood and the community that you live in. These are all ways in which we can ask more open-ended questions that can help us avoid microaggressions in our work. And then I've already touched on this: validating experiences, believing, responding with validation. I can see how that hurt you. Promoting coping strategies. Treat like a chronic stressor, as I mentioned before, as you would any chronic stressor or traumatic event. Pursuing kind of a line of therapy that allows you to sort of look at it from that. I think sometimes we think about it and we don't believe folks when they're telling us they're microaggressed. And oftentimes it could also be, especially when we're talking about some of those unintentional, nonverbal and behavioral exposures to microaggressions, right? It can almost seem difficult to make the connections. And so our biases come up. So again, really understanding the experience of the person and the experience of that microaggression as a chronic stress or a traumatic event, providing psychoeducation. I think you saw that in both of the videos today. Psychoeducation about microaggressions, but also psychoeducation about the impact of chronic stress and traumatic experiences. And then helping to promote mindful practice. So some folks have Howard Stevenson, who's done some work in this area around processing racist events that occur. He uses the CLCDE approach, calculate. That means kind of calculate the feelings that are coming up, how severe those feelings are, how angry one might be, how frustrated one might be. locating it in the body. So this is kind of a mindful practice, is locating it in the body and where you're feeling, where those feelings are coming from. Communicating, that is communicating the messages that are coming up, the self messages, the self talk that's coming up, breathing and exhaling. This is just a way of kind of processing and giving folks coping strategies to process those racially charged encounters that they might have in their lives. And then understanding and validating various forms of coping. There are many different ways to approach microaggressions, as you can see with Jade, very directly, and there can be those ways. There are all kinds of forms. Sometimes folks seek support of others within their community. Some folks address it through humor. Some folks address it by just engaging in healthy practices, healthy lifestyle practices. There are a lot of different ways of coping. One of the important things to remember is that coping is not one size fits all. Every individual has to have space to develop their own coping strategies when it comes to exposure to microaggressions. And then I'm going to turn it over to Leslie to talk about the organizational level and some of the ways that you can use the resources that we've have laid out for you all.
Great. Thank you so much, Jim. I think just for providing that overview, and also in jumping to the organizational level, this can often and sometimes be the most difficult level to really implement that, again, because of the structural level that these systems of oppression work. They are really ingrained and embedded in our institutions and the way that they practice. And so the ability to examine organizational shortcomings and also areas for improvement really requires a level of radical vulnerability. It requires a growth mindset that acknowledges maybe some of the harms that organizations may be perpetuating within their structures. And so we'll be going over this discussion guide that we have linked in here in the following slides, just to think through some ways that organizations can sort of unpack these things. And we have some guiding questions for supervisors and administrators as well to help sort of facilitate these conversations. And a big way we've talked about, let's say, 3 kind of different buckets that these microaggressions can come up. So firstly, it can come up where a client is experiencing microaggressions, they're going to the therapist and unpacking them. And it can also come up from the therapist themselves. And so I saw a comment in the chat about, if you're a clinician or a therapist and you have clients who come from different racial, ethnic backgrounds, but also just different historically marginalized identities, and kind of acknowledging that power difference, that power imbalance. And I think I just wanted to acknowledge that comment because just the acknowledgement of where you're coming from, how you identify can really help to support that relationship, set the tone, and really understand kind of those differences in that power dynamic. And so really appreciate you, Amy, for sharing that comment. But supervision in particular can also be a really great way to sort of embody this rupture repair that Jim was discussing. So apologizing, maintaining that trust. And I think supervision can be a great way to unpack that, both if you, as a clinician or as a therapist, commit a microaggression to a client, or if a client is coming to you sharing that microaggression, just some of the things that might come up and emotions that may come up for folks, especially if you share, let's say, an identity or a historically marginalized identity with some of your clients. And lastly, creating inclusive environments. And so we talked about the importance of something like an intake form being the very first thing you typically encounter when you go into a clinician's office. And from the get-go, if you don't feel included in that space, you might already automatically be sort of shut off in that therapy session or with that client. So just from the get-go, really thinking through all the steps in the process and the workflow as a client kind of moves through that process. And just, I think, keeping openness, really learning from others. I think microaggressions are one of the things that, if and when we likely commit them, it can feel not great for ourselves either. So just a willingness to accept our shortcomings, accept that, like I said at the very beginning, these are really learned and deeply ingrained behaviors that interlock with systems of oppression, right? So it's very deeply set in how we've been cultured and how we've grown up in the society, even with the video that Jim showed for the dolls. And they're really deeply set things, but just the acknowledgement and awareness of them can really help us to sort of unpack and unlearn those behaviors. And lastly, conducting an organizational scan. I think this goes back into the piece of just organizational growth, organizational, just listening to what is happening in that space, and just examining maybe some of the factors and things that may perpetuate some of these harms. You can go to the next slide. Okay, perfect. And so this is a discussion guide that we created, and it's really meant to be an accompaniment to the very first video that we shown, the animation video. And so it really helps, it's meant to help organizations sort of hold a screening, maybe with staff. We have some learning objectives of what we hope people to get out of this. And on the second page, we have a good amount of discussion questions. So thinking through just really where microaggressions come from, and also want to highlight the importance between impact and intent. So really the notion of we might not have harmful or negative intentions, but that impact still can hold true. And I think that's one really critical piece. If you perpetuate microaggressions, if you receive them, that's the piece that was mentioned in the chat, right? Those 1,000 jabs that kind of continue and accumulate over one's lifetime. So really just acknowledging that impact, and just some different questions around power dynamics, like was also mentioned in the chat, as well as some suggestions for supervisors and administrators to really think through that organizational level piece. So for example, what are the ways of disrupting microaggressions and thinking about accountability if you perpetuate or experience them? So just thinking through some of those different power dynamics as a starting place for organizations. We highly encourage you to look through these, and these will also be included in the resources section at the end of the presentation. Yes, so they are linked on here. We also have some internal resources linked that CTEC has done specifically around cultural humility, a really great one around liberation psychology for providers, as well as some external resources. I know we had some folks sharing more great resources in the chat, so highly recommend this just as a starting place. There's tons of resources around microaggressions and biases, but we've hopefully narrowed it down a little bit so it's a bit more digestible for folks.
So,
and we have a couple minutes, so I know folks have been putting some questions in the chat. Feel free to keep doing so, and maybe I'll turn it over to you, Jim, if you want to start off with those.
yeah, I just want to acknowledge a few more of the comments that came in about the video that we saw earlier. And then I also want to ask folks to please continue to share what you have seen, with any questions that you have, but also what you have seen helps to address, mitigate the impact or the occurrence of microaggressions in the workplace, in the work that you do in your settings. But as I said, as folks are thinking about that, some of the other comments, there was no shaming or telling her how she should feel. Thank you, Amanda, for that comment. Right? No telling someone how they should feel in response to being microaggressed or exposed to racism. I like how the counselor apologized. Yep, please feel free. Oh, excuse me. Being attuned to the moment by moment experiences of the client. Yes, again, that listening, attuning to the experiences of the client are critically important. Validation. So as we think about some of the things that you've seen, and also any questions that you might have about microaggressions and about the materials and resources that are available, our hope is that we can give you some of these tools so that you can continue this conversation in your organization or in your settings. But I just want to sort of take a look and see. Yes, Amy says, many people I interact with are of different ethnic backgrounds. I feel it is powerful when I acknowledge our differences and tell them from the first meeting that I want them to help me better understand things from their perspective. It sets the tone that I understand there are differences, but I am trying to see past them and to help them. Certainly, that is a part of just practicing a good culturally responsive care, generally speaking, right? Anytime that we're sort of addressing differences and really kind of naming oftentimes the elephant in the room, but being clear. So if you are of different race, different ethnic backgrounds, obviously different genders and sexual orientations or gender identity, it's often really important to sort of put those differences on the table early on to create conversations about where there might be blind spots. So great point, Amy. Desiree, how do you communicate and address that to the teacher's aide when they are expressing this microaggression in the classroom? So I see, yeah. So I think there's also some systems interventions. And I think much of what we've been talking about today, right, is how do you deal with microaggressions on an individual level, and of course, to support the children, youth, and families that you work with. As we think about that, that's often a tough one. How do you bring these issues back to the people who may have microaggressed in settings like schools? And how do you create the space to have those discussions? I'm open to sort of anyone who wants to share experiences with that, but oftentimes what may be necessary is having a conversation with that teacher and approaching it hopefully in an open way to provide the youth's perspective. I also think that in many ways, as mental health practitioners, we have a role that we can play in being able to train and provide information to others. So I spent a lot of time for many years working in a school-based mental health setting, and I would often do trainings on mental health related topics. I think it's important as mental health practitioners to be able to bring some of these issues back to schools, train teachers, and helping them understand the impact of implicit biases. So some of it may be a training issue, and then some of it may be sort of getting together with folks and trying to provide that young person's experience. Oftentimes, as mental health practitioners, we know the stories. I often like to say, as a mental health practitioner, is when you know the story, the responses make sense. And so being able to communicate on behalf sometimes of young people or helping young people to improve or sort of communicate in ways, maybe improving is not the right word, but helping young people to communicate their experiences to others in ways that can help them hear it, as well as confronting it as well. So it can get very complex in terms of how we approach the work, but yes. And if others have other things that they've seen that can help address when microaggressions occur, and how you can sort of address it with the aggressor, I'm open to discussion.
Yeah, and Jim, there's a really great question on that came through the chat. If maybe you could speak to this. So someone asked, could you say something about how, as a provider, if somebody approaches you with anger before you open your mouth based on your ethnicity, and I'm assuming just shared or not shared backgrounds, what implications that may carry for them?
So I'm sorry, one more time, because I'm not sure if I understood the question.
Yeah, so they said, could you say something about how, as a provider, if somebody approaches you with anger, I'm assuming microaggresses you in that context, before you
Okay.
open your mouth, just how to navigate that and what implications that may carry for them?
Okay. Yeah. So I think in many ways, I think as practitioners, we often have to use the tools that we use. So we oftentimes will counsel or as part of therapy, help people sort of develop the ability to communicate their concerns and be assertive in helpful ways. And so I think about what we oftentimes encourage people to do, whether they're young people or older people, is the use of I statements, right? This idea of how you were impacted and being able to communicate to someone something to the effect of, when you said that, this is how it made me feel. This is my reaction to it. And being able to describe in detail what that meant, right? It impacted me. These are the feelings that came up. This is why those feelings came up. I felt whatever. I felt invalidated or not seen. And then oftentimes, as we think about I statements, ending with a request. That request can be to be respectful or to have a conversation, a more sort of calm conversation. But the use of I statements, speaking from your own experiences, and being clear about how the person's communication or messages have impacted you. And sometimes that can be a little bit more effective than sort of the approach to just confront. And yes, it's important to confront if that's how you need to process. Again, I also want to be clear that as I said before, people have very different ways of responding. Some people decide that they just want to ignore. Some people decide that they want to avoid. Some people, again, as I said, may process it and avoid the confrontation and process it with friends or others in affinity spaces. I like to think that they're all valid. I don't want to put someone in a space where they feel like they have to respond in the right way, like there is a right way to respond.
Yeah, and I'll add on to that because I think there was also a question about how to address microaggressions in the workplace. And similar to what Jim was saying, I think there's different methods, there's different ways. I like to think that in the moment, if a person is able to, has the bandwidth, is just physically and mentally in a space where they're able to do that, to call that out. And that's really what Jim was saying about naming the elephant, addressing the elephant in the room, and just calling that person in and having that be a moment of sort of education. But I also recognize that that burden often falls on people of color, on people from historically marginalized background to sort of do that education for folks rather than, that being a process that they work through themselves. So I think highlighting again the importance of responding in the way that feels appropriate and necessary and feels good for you in that moment, but also unpacking that, like Jim said, in affinity groups, and having some spaces on the side to really work through what that was. And also just the comment in the chat, trying to find it. There was a comment about the experience of passing. I'm assuming that's passing as white or non-white. I can speak to that. Again, I'm multiracial. I think that's just been my experience. I get called exotic a lot. And so a lot of the examples that we shared today are very, very general, very high level, but they're absolutely microaggressions that are more specific, for example, to multiracial folks, to folks in the LGBTQIA community that we didn't quite get to tap into in as detailed of a way. But absolutely, that is a big experience of kind of the passing piece of it.
And I just want to point out, Tanya Parker says, I will be using this training to move forward with adding trainings to my agency. A refresher is always a good thing. And actually, that was one of the goals that we had in mind when we put this webinar out there is for you to continue this discussion in your settings. You please feel free to use the resources. All of the resources that we've kind of addressed and cited today will be on the website and available for you all to use in whatever way you see fit. Fantastic.
And with that, we'll close out in our last few minutes. And so again, we have our slides that will be posted. Slides and all the resources that were shared in this presentation are going to be up on our website, www.ctacny.org. It is also in the chat, and those will be posted within 2 to 3 business days of the event. And we also invite you to join us for some upcoming events that we'll be having. So the first, Pathway to a Family Peer Advocate Professional Credential. This will be a 2-part event. And lastly, we have an event on trauma, responsive, and affirming practices to reduce suicide amongst trans and gender expansive youth. So both great events that are coming up. Highly attend you to join and participate in those. And if you can go to the last slide, Vanessa.
Oh, that is the last slide. Yeah.
Is the last slide? Okay, perfect. So again, thank you so much for attending today's webinar. Vanessa, I know put it in the chat, but if you could maybe put it again, we have a short survey. We'd really appreciate you completing that and just providing any feedback for today's webinar. And also encourage you again to visit our website for past trainings, resources. And if you have any other questions, please feel free to reach out. But on behalf of CTAC, thank you so much for joining us today and have a great rest of your day. And we'll give you a couple minutes to fill out that survey.
Yes, please complete that survey. We do look at them. And especially if you want to share with us any topics related to today's topic, of course, and any other topic that you want regarding children's mental health. So we'll just take a moment and give you all a couple of minutes to complete that survey. While folks are doing that, because I know we still have a couple of minutes, I just want to mention that, yes, Some of the other comments, I just want to mention, Martha says, my experiences have been very different. I work in a rural, primary white and poor community. The majority of microaggressions I experience stem from clients towards others. Okay, and that can certainly be a topic of its own, but how do you address when clients are sort of sharing microaggressions about others, sharing their views or beliefs about other groups? And I think that might be a better topic to address at a separate occasion. But I would also say that sometimes creating a safe space, safe enough that you can bring up the topic of folks' microaggressions or attitudes about others, can be extremely helpful and can sometimes lead to people understanding their own experiences of microaggressions, right? Having them. So in a rural community, sometimes those microaggressions can be around class, right? Can be around class, or it can be around mental health challenges. So I think also engaging folks in their potential experiences with microaggressions as well can be an important topic to have. Okay. Well, thank you all, folks. And we will hopefully see you again in future offerings.
Thank you so much, everyone.